Afternoon. I'm Dr. Kenneth Qiu. I'm joined here with Andy Smith and Dr. Kyle Rickner. We're going to talk about direct primary care. So direct primary care historically has been known as a model that is focused on direct patient payments. Recently, there's been a lot of evolution where the model has grown more resilient by engaging with employers and others. And this shift has happened not because we're compromising who we are or our core values, but because direct primary care now is in the driver's seat. We're in a position where we can do so. Historically, insurance companies have had a perceived monopoly on payments. They've used this perception to bully independent practices into contracts that are terrible and unsustainable, and part of the reason why direct primary care exists. But we're here because we're monopoly breakers, right? And DPC has flipped the script. Now it's independent practices that can set the terms, engaging third parties in a way that works for us and aligns with our mission to deliver high quality patient-centered care. And in a free market where practices are allowed to innovate and patients are allowed to choose where they go, you have better models that will develop. And by showing that high quality care can not just survive, but thrive outside of the health insurance system, DPC has forced the market to adapt to us and not the other way around. And coming from a position of strength, we can use that to continue to grow the DPC movement while maintaining who we are. So when I started my practice straight out of residency a little under 4 years ago, I thought about both individuals and employers. And in fact, a lot of DPCs now that start, they have employers in the back of their minds. And to give you some historical context, 7 to 8 years ago in our community, that was taboo. People wouldn't even talk about it. And now it's become kind of standard. And Dr. Rickner started Primary Health Partners 9 years ago, and they also started with just retail patients, the individuals. But since then, PHP has been a pioneer in engaging with employers, and last year taking the step of even working with an ACA marketplace insurance plan. And so we'll talk about that today and just show how this is possible and how it may help. So again, Dr. Rickner is the founder of Primary Health Partners, and Andy Smith is their new CEO who has come to the resistance from the bukas. So welcome.
Thanks. Yes, giving a round of applause.
All right, so one of the big concerns in the direct primary care space is that working with third parties, and employers being the first third party that was entered into the DPC space, is things will change. We can't do what we do if somebody else pays for it. So when you started working with employers, how did it change your clinical delivery and just overall workflow?
Yeah, so I think it'd be relevant to share the story of our first employer. So a patient of mine had a small business. We were open less than 60 days, and he came in for his visit and he said, my employees need this. And I was like, they do? That'd be great. And so he had us come to the place of work and we presented what we do. And his intention was just for them to hear that. And then he told them all to line up and sign up and had us show up with our laptops. We signed all 22 employees up for a membership. And then we let him know we were done. We'd been open about 45 days at this point. We were cash flowing the practice ourselves. And he handed me a check for the annual membership for all 22 employees. And I thought I had died and gone to heaven. I was like, wow, cash flow problems are fixed. This employer thing might be something we need to think about. But the point is, he experienced direct primary care before he wanted to offer it to his employees. He wanted for his employees what he had experienced. And so to answer Dr. Qiu's question, we didn't change a thing. And I think that's one of the guiding principles of DPC is that what we do is the best way to execute primary care. It absolutely is. So why do you want to change it? And so we've actually held to that as we've changed over time and maybe taken care of some little bit larger employers, and we've stayed true to this is how we operate, this is what we do, because that brings the best product to the employees and the employer.
Yeah, right. And it sounds like, at least starting off, there weren't too many challenges, but you've gotten a lot more sophisticated with much larger employers. Did you face any major challenges when it got bigger versus just the guy in your neighborhood?
Yeah, there's still challenges. I think one area that the DPC community as a whole is really lagging behind is the ability to prove what we do in terms of data to the employers. So when people are spending a lot of money on the care of their employees, they'd like to know what they're getting for that. So we've been able to provide some reporting to our employers, but we view it as being somewhat inadequate. And part of that's because they're coming from a world of the claims data world from insurance plans, and that's what they're used to seeing and everything coming through that. And since we don't generate any claims, that data is not readily available to us. So I think some of the challenges is not only telling your story, but showing the numbers and the value that prove the story out.
Yeah. And I think over the years too, that two things came up too, is the financials and the HR depth. And so recognizing that these HR business leaders or office managers had more on their plate than just deciding about primary care. They had, training and recruiting and development and policies and 18 other things that, coming from the healthcare side, we didn't realize when we were coming to them saying, hey, we've got a solution. And so getting wider and deeper depth in that HR space to come and say, hey, how do we become a partner with you? And whether you're an HR manager or the office manager or the owner of the company that just happens to be figuring out benefits for his people, or the leader that she's got a small company and wants to know how to serve them well, we've come a long way in saying, let us sign you up in the, with all your team to saying, hey, we can be a part of your benefits like this. And so I think that was one. The other was the financial implications of taking retail versus working with an employer group, and how do you set up those processes and structures to have that relationship. So
Yeah, great. And a lot of business and a lot of what we're talking about is figuring out yes and, right? Solving problems and helping more people. But I think one thing with DPC, especially since we're new, is, where do we draw the line? How do we not become the system all over again when we engage other people? So have there been any employers where they have certain demands of you and you're just like, I don't think this works?
Maybe in the process of, we're considering adding this service, this is how we would like it to be executed. And we've taken the position that this is how we execute. This is the best path forward. And so this is what we're offering. Our current clients, we don't have requests from them that they want us to change how we do things to suit them necessarily. And I think that's one of the, at least for me, and I get Andy's thoughts, is the value that you bring to them is really inherent in what you do and how you do it. So if you become an operational chameleon, you're actually devaluing yourself and spreading yourself thin, and you're going to not be a repeatable product that has value in the marketplace. So figure out best practices that'll bring the highest value, and then you can offer that value to anyone. I don't know what you think.
No, I agree with that. And I would say that clarity up front and communication, education, and we've seen a steep learning curve to where groups will come in and maybe they want to leverage us and utilize us, and we're trying to tell them what we do and how we do it. And then after a year or 2 years, they start to see it with their people. And so they're not pushing back if they were at all. Instead, they're pushing the other way, saying, how do we get more of our team to leverage you guys? And so I think that comes with that clarity and communication, to your point of holding to what we do and this is our value. And then it just may be a little slower coming on board.
Right.
Yeah.
Yeah. And then what comes normally when you master this art is more people are interested, right? And so one reason that there's a lot of interest in the employer space is because employers provide some sort of healthcare health benefit for 50% of Americans, 100 some million people, right? And the DPCs that learn to engage with employers tend to grow bigger, faster. And so there are two things I think that are big fears in the DPC community, one of which is who to engage with, third parties. And second is growth, because a lot of times people don't know how to handle growth, or they worry that growth turns into corporatization, which then dilutes everything. So how have you been able to handle the growth while working with employers?
Well, I think I'm going to push back on your comment. You said once you mastered it. I'm not sure we mastered anything yet. We're figuring it out as we go. But with growth, there's change. And I tell our people that the one constant around here is going to be change. And then you have to make a decision in DPC. Do you want to grow, and how much, and what does that look like? Because you may just be careful what you ask for. But for us, we've had to actually change things as we've grown and realize that what worked at a smaller level may not work when you try to scale it. So your processes that are not too precise get exposed, and so you have to revamp them and do that. So you hope it'll help you become better and better as things scale a little bit. You begin to realize that, hey, we had this method of doing this, or this was our standard operating procedure, and it's just not going to work moving forward as we scale. So some people would refer to that as corporatization, but it's honestly just making sure things work really well for everyone involved.
Yeah, I agree. I do a lot of things different with 3 kids than I did with 1. But that, along with really understanding that these employers that we are talking about, right? Yes, they cover half of Americans' population, but they also care for their people just as much as we care for our patients and we care for our teams. And so they're out there looking and saying, hey, we're not just looking to check a box or to get a cheaper bottom line. Like, we want to attract talent. We want to pour into our employees. And when you kind of recognize that, then it takes that corporate mindset, or that it kind of brings it down to the personal level. Hey, this HR director that we're talking with has X amount of employees. They care just as much as you do about their employees as you do yours. And so when you connect those dots, you really want to work together and say, hey, okay, we're gonna have to make some changes to support them, but how do we do that so they can support their teams too? Yeah. Exactly.
Yeah, absolutely. And I think a lot of us have seen in this conference the interest around employers working with various numbers and levels, but you took the extra step last year to innovate once again, and you're working with a health insurance plan that's on the ACA exchange, Terra Health to be specific. Why?
Yeah, so I kind of look at the idea of what limits do we want to put on the patients we want to reach? How much? So that group over there, if they get their care that way, we don't want to try to help them. We only want to try to help this group. So different customer acquisition channels have to be looked at. Now, I was fortunate because Dr. Qiu introduced me to these very sharp guys several years ago now, that had built a DPC business on the East Coast about trying to help local DPCs. They are not doctors, and they did a lot of good. They helped bring patients to the front doors of some DPCs, but they saw that their impact was maybe not as broad as it could be. They both had a background in insurance and startups and some other stuff that you have to have. And they literally said, what would you think if we built an entire insurance company solely on the chassis of direct primary care? And I was like, wow, that's cool. I have a lot of questions. And we can't cover all of the details today, but it was built in such a way to make sure, and them asking along the way, what about this? How do you guys do this? So their goal was very important. I don't want to change one thing about how you operate. Your doctors aren't going to click one extra box. Nothing. I want you to be able to do exactly what you do and how you do it, because that's the product we believe has this value that can even be shown through an insurance mechanism. So to me, it was just an exciting opportunity to capture patients that we wouldn't otherwise have access to. And honestly, to this day, as we're in our second benefit year with them, we haven't had to change anything about how we operate in order to work with them, which I find amazing. So I don't know what your thoughts.
No, they are great to work with. And I think other models are coming to light even in the last year or 6 months, to where people are seeing these changes in the marketplace and in what we've been talking about for 2 days, to where they're saying, I want something different, right? Brokers are saying, I need something else that will actually help. I need something else that will help my teams. And employers are coming out and trying to connect these types of products or pieces together in ways that are new. And I think that's the future. And so we just have to make sure, as we put DPC in the middle of it, that we do protect what we do, that we are driving from the middle and not just an add-on that's kept in the dark and kind of thrown a bone a few times. And so that's not what Dr. Rickner's been building, and that's not what we're doing as an industry. So
Yeah, and I think I would say this: this is a way to bring a free market principle to even a government program within the ACA. People still have to choose the plan, and how does the plan perform? And my belief was, and the founders of Taro's belief was, we're going to outperform all of them, because with a foundation of DPC, this plan will perform well. And if it does, it's going to win. So it'll win out on the cost curve on the exchange. And then guess what? We get to kick the bukas in the teeth a little bit. We get to take business away from them. And so that was exciting to me. I can tell you that in the year 2, there was a 10x growth in Oklahoma in the product. The plan performed very well, just like we thought. The cost came down in year 2 from year 1, and we expanded its reach. And I think we're just getting started with it.
Yeah, and I think a large part of why DPC grew was there were 2 things that happened with insurance. Didn't pay too much administrative cost. And it sounds like Taro has fixed that, because they're not changing how you do things, and they're paying you, I assume they're paying you what you want, otherwise you wouldn't engage them. But Annie, you mentioned something about not just taking the bone while it's thrown and then, down the road something happens. I think a lot of people are concerned about slippery slopes with third parties. It's like, yeah, we'll engage with you how you want today, and then tomorrow I just want this thing, and also I want this thing, and then we're back to where we started. So do you guys have any safeguards for both employers as well as the health plan to make sure that you keep your integrity on how you do things?
Yeah, I think it's just a commitment to what we talked about before, that in principle, this is absolutely how we operate. These are the values we're not going to go against. We're not going to compromise the product in order to please any one person. We know the value that the product brings, so we're going to let that speak for itself. And, there is a cautionary tale. In fact, it can be with not just an ACA insurance product. It can be with any employer who you start working with, and maybe they have additional serial demands. And you know what? We've not had that experience at all. In fact, the employers have chose to incentivize their plans to have more people in the DPC product. And we just do what we do. And again, it's just realizing we have a great product. It can execute under any circumstances. That's what we do. We have had requests from employers. We would like for you to include this, this, and this, and then we're going to just ask for the price to come down. And we just can't do that. We're not trying to run away with profits, but we're not going to run a bad business. We're not going to demarginalize ourselves entirely just to sacrifice it on the altar of a little bit of business. And so we have to stay true to who we are, no matter what, because if we don't run a good business, we're actually doing bad patient care. And we talk about every principle that we operate on is patient-centeredness. So every decision we make is with the patient at the center. And that includes all business decisions. Running it on a foundation of good business principles is actually what's best for the patient. I want to make sure that the doctors in the clinic and the practice can be there. And so if we start having unhealthy business practices to compromise the way we operate just to satisfy to get more business, we're ultimately not going to be there.
Yeah. And I would say the relationships, it comes down to relationships and understanding. And so even just as maybe 2 months ago, we had a potential partnership path, and we could tell they did not know at all what direct primary care was. And they came to us with a whole bunch of numbers and ideas, and it was just revealing, hey, this is not what we're doing. It's clear you guys don't understand what we're doing, even though DBC's written all over this. And that's an example of something to where it would have been easy to rubber stamp it and say, sure, send any patients our way. But we said, no, we're not going to do this for these reasons. And then being very clear and building relationships with partners, networks, brokers, everyone in this room this week, right? And getting to know that they know what we're doing and what we're trying to do in the industry. And I think relationships and those partnerships.
Yeah. Relationships really are the core of DPC, right? We have the doctor-patient relationship, and there's just a lot tighter, I think, practice-employer relationship. Even the Terra guys is very relationship-based. They visit a lot. They were just in Oklahoma. So I think because our time is limited and I do want to hear some questions, we'll open it up to you guys. If you have any questions about what we talked about. Sure. I'll just repeat your question so it's on the mic. But the question was, where does private equity fit in all of this? And that is, I think, a very big question in our space. I'm sure a lot of you have heard PE in the DPC world stands for pure evil. So I'll pass off to you guys. What do you think about private equity?
There's really bad private equity. There's also some really good people trying to do some good things. I think we have to understand that in order for us to scale what we do to a meaningful level in this country, what does that mean? Maybe it means we're taking care of 100 million members in this country. That's going to require finance. And so we have to look at financial opportunities through the lens of scrutiny, of not changing what we do, devaluing what we do. You have to have super careful consideration. If you've seen one PE, you've seen one PE. They're very different. A lot of them are very different. So I don't vilify them categorically. But I look at them cautiously. But I also look at the idea that financing coming into the DPC world is probably going to be some fuel that we're going to need on the fire to spread to a meaningful national level at some point.
Yeah. I would say it comes back, I agree with Kyle for sure, but it comes back to relationships entirely. Like you said, if you've met one PE firm or one individual at a PE firm, then you've had that. So that alignment is key. And then the other thing is that there's such a gap between the healthcare industry right now and how DPC is operating that there's so much room for growth in experience, in cost savings, in all of what we've been talking about for 2 days with the inflated numbers and everything. And so I don't foresee DPC coming alongside and growing at that and trying to jump in that margin. I see it just, hey, we can live here for years to come and do better and do more for our patients. So yeah.
Any other questions working with employers, insurance companies, direct primary care in general? Yeah, so I'll summarize the question. So we have a new DPC doc who comes from a family of small business who experienced firsthand the troubles with providing healthcare as a small business owner and trying to learn. And so what advice can you give to somebody who's smaller, starting out and wanting to work with employers?
So for me, I always say start with the end in mind in terms of where you want to end up. And, if I were a single doc practice working with employers for me would probably mean looking at smaller groups that may not even have a health plan, or they may have a health share, or, you're looking at groups less than 50. When you start getting into incorporating into self-funded plans, et cetera, the level of complexity really goes up, and it stresses your infrastructure, what little you have, and that can compromise care. And then you start to have all these worrying concerns. So that's where it start with the end in mind. And if you say, well, I want to grow a network of clinics where I'm at, and I want to have 10 or 15 docs, and okay, well, then you have a lot to learn. But our first company, that story I told you, was 22 and there was no health plan. And I took the check that night and they were enrolled and we were off and going. And that was as complicated as it got. And so that's a great way to start. Start low and go slow. Start small, dip your toes in the water. And then if you have a local advocate that can actually bring you employers. So if there's a broker or someone that can bring you employers that will do some of the hand holding on implementation, all the better. If you're trying to do all the implementation on your own, it gets super complicated quick. So I would start low and go slow and learn just like you are now. But if you're keeping that end in mind, you're nodding your head, several clinics, 15, then make it a point to learn as much as you can. What would you say?
Yeah,
Andy?
I would say that start low, brokers, local advocates, and then try and figure out how the watches are made, right? Like everyone's looking at the time and figure out the pieces of those HR puzzles and understand what those needs are where you can fit, and then start to grab local folks that are engaging in those areas and build that. Yeah.
Yeah, I'll chime in on that because I'm newer, smaller practice as well. You don't really have a choice but to go low and slow, because as one doc in one location, you're not going to get a self-funded employer with 50 employees, because odds are they're going to be geographically spread out. And also to convince them that all of them have to change PCPs to you is going to be a big lift. And so just getting to know some of the business owners you have, and then you'll get stories like Kyle's where they're like, oh, this is great. Can I give it for my employees? And you hear this story repeated across DPC practices around the country where a CEO will join and then their employees join on. And then, as it grows, they become more sophisticated, have more centers. And then you can start moving into kind of the level funded, self-funded, larger employers. So I think, just being realistic with both your timeline and who you're chasing after is important when you're at the stage. And you mentioned Aptly. There's a bunch of these networks now that help independent DPCs plug into larger employers. So those are also things you can participate in.
Yeah. That's a good point. Can go after the decision makers and like CEOs, the HR individuals, and say, hey, you want a free 3-month, 4-month membership? Test it out, that type of thing. As you can do that. You can, or not free, but get them engaged.
Cool. All right. I think that's all the time we have. I got a signal, so thank you so much for being here.